FDA warns overdoses linked to 7-OH in gas stations. The FDA takes a bold stance in tackling an alarming public health crisis. On Tuesday, the Food and Drug Administration called upon the Justice Department to categorize a compound known as 7-OH, which possesses effects similar to opioids, as an illicit substance. This compound is frequently found in unregulated products like gummies, tablets, and drink mixes that are readily available at gas stations and convenience stores. If the Justice Department follows through, access to these products, which are also available online, will be severely restricted or entirely banned. Commonly referred to as 7-hydroxymitragynine, this chemical is often promoted as a means to enhance relaxation, alleviate pain, or boost mood and focus. However, research indicates that its potency might exceed that of morphine, raising significant concerns. The FDA has highlighted serious risks associated with its use, which can potentially result in harmful effects on the heart or liver, as well as seizures, digestive complications, shallow breathing, withdrawal symptoms, or even fatal outcomes. Jim O'Neill, the Deputy Secretary at the U.S. Department of Health and Human Services, expressed grave concerns over the increasing incidence of overdoses, poisonings, and emergency room visits linked to products containing 7-OH. He pointed out that these products are often sold without adequate warnings and lack quality or dosage control, which he described as a recipe for public health disaster. 7-OH is derived naturally from the leaves of a tropical evergreen tree, with kratom being an herbal extract made from those leaves that is frequently sold as a dietary supplement lacking regulation. While kratom products contain only trace amounts of 7-OH, the products marketed explicitly as 7-OH consist of a synthetic and concentrated form of the compound. Alarmingly, some of these products mislead consumers by branding themselves as kratom, according to the FDA. The FDA's directive will lead to a review by the Drug Enforcement Administration, DEA, the branch of the Justice Department responsible for regulating controlled substances. There are 5 different classifications that determine the level of regulation, each based on the substance's medical application, public health implications, and risk for abuse. During the press conference, FDA Commissioner Martin Makary urged that 7-OH should be classified as a Schedule I substance. This classification implies that it has no recognized medical use and poses a high risk of being misused. Similar substances in this category include heroin, ecstasy, and marijuana. Currently, the FDA advises against using kratom products, citing the potential for serious side effects, including seizures, liver damage, and the risk of developing a substance use disorder. In 2016, the DEA had initially considered classifying kratom and its active ingredients, including 7-OH, as Schedule I substances. However, due to strong opposition from kratom supporters, the agency abandoned this effort. According to the National Survey on Drug Use and Health, approximately 1.9 million individuals aged 12 and older in the U.S. reported using kratom in 2022. Tom Provoznik, an assistant administrator at the DEA, assured the public at the press conference that they would still have an opportunity to provide feedback before any final decisions are made. The DEA will continue to adhere to scientific evidence, follow the law, and prioritize community safety, he stated. Health and Human Services Secretary Robert F. Kennedy Jr. shared a personal anecdote, reflecting on the past accessibility of heroin that contributed to his own addiction. He voiced concern about the widespread availability of 7-OH products in close proximity to schools, military bases, and low-income neighborhoods. He described the marketing strategies of these products as particularly alarming, emphasizing that they are branded appealingly for children, such as gummy bears and brightly colored packaging. In late June, the FDA issued warning letters to 7 companies identified as illegally marketing products containing 7-OH, stressing that this chemical cannot legally be incorporated into standard foods or dietary supplements due to insufficient safety evidence. While dietary supplements do not require FDA approval for sale, companies must still test their products for ingredient safety and contamination. The responsibility to identify unsafe products and remove them from the market lies with the FDA, focusing specifically on 7-OH, Commissioner McCary remarked that the intent is to address the more dangerous synthetic variant first, distinguishing it from the trace amounts present in kratom products, saying, "We are going after the killer first." The Holistic Alternative Recovery Trust, which advocates for using plant-based substances to combat opioid addiction, criticized the FDA's recommendation. Jeff Smith, their national policy director, argued that if 7-OH truly posed an immediate threat justifying such urgent action, substantial evidence would need to be presented, which he claims was absent. Supporters of kratom assert that it can aid in pain management and help individuals struggling with substance use disorders gradually detach from harsher opioids. The American Kratom Association, representing kratom users, has indicated a willingness to comply with FDA regulations, such as labeling and age restrictions, but contends that kratom does not warrant a classification as a controlled substance due to its low potential for abuse. As the conversation continues, it invites crucial questions. Do you think these products should be classified as controlled substances? How do we ensure safety while respecting personal choice? Share your thoughts in the comments. U.S. government takes action against dangerous opioid 7-OH in a significant move to address the growing concerns surrounding the perilous opioid known as 7-OH. A press conference will be held featuring prominent figures in health and government. This is a critical moment for public health, and the stakes couldn't be higher. On Tuesday, July 29, 2025, at 10:30 Eastern Time, U.S. Health and Human Services Secretary Robert F. Kennedy, Jr., along with Deputy Secretary Jim O'Neill, FDA Commissioner Dr. Marty Makary, and U.S. Senator Markwayne Mullin, will unveil new initiatives aimed at safeguarding the American populace from the dangers posed by this substance. But here's where it gets controversial. The opioid 7-OH has been linked to numerous health risks, and the actions announced at this conference could spark intense debate about how best to manage opioid use in the country. Details of the event. When. Date. Tuesday, July 29th. Time. 10:30 a.m. Eastern Time. Press should arrive by 9:30 a.m. for priority seating. Entry requirements. Attendees must present a real ID or a valid U.S. passport to gain access to the venue. Where? Location. Hubert H. Humphrey Building Auditorium. Address. 200 Independence Ave Southwest, Washington, D.C. 2009. Participants. Robert F. Kennedy, Jr., HHS Deputy Secretary Jim O'Neill, FDA Commissioner Dr. Marty Makary, U.S. Senator Markwayne Mullin, ROK. Melody Wolf, a survivor of chronic pain, will also share her insights. And this is the part most people miss. End of report. You can catch the live stream of this important event on X at HHS.gov. To attend in person, if you wish to be part of this pivotal discussion, please request a press credential by emailing mediarsvp@hhs.gov. Note: registration must be completed by 8 p.m. Eastern Time today. This press conference is not just another event, it represents a crucial step in the ongoing battle against opioid misuse. What are your thoughts on the government's approach to managing opioids? Do you believe these measures will be effective? Share your opinions in the comments below.